Uh, Thank you. It would be hard to continue with my talk after such a beautiful idea and interesting talk, but I will try. I will try more to focus on some facts and things what's going on in the Czech Republic. You got a question for how many years already we are in the cannabis business, cannabis science, cannabis world. And I have to say that in my point, it's almost 10 years. And the reason it's quite easy because from 2013 it's legalized in Czech Republic to treat patients. Yeah, it's legal to use medical cannabis. Yeah, legalization is another question. It's in these days, but we will focus mainly and strictly on medicinal cannabis from the point of treatment, from the point of research, and also because we are on a, let's say, commercial business meeting, also from the little bit point of money. But I have to highlight, I'm coming from the University Hospital St. Anne. We are run by state, so our major purpose is not to earn money, which is also important, but question for you, what is most important to do in the hospital? To treat the people. Yes, please don't forget on that, even when we talk about the cannabis. Yeah, so this is the major point what for us is important. So about the talk, it's not only about me, it's also about some small group of people, about my team, what I'm very proud of them. So these people are helping to develop cannabis research and also now cannabis production in Brno, in my city, which is the second largest city in the Czech Republic. And I know that we have people here from different parts from the world, but for me, the trip here was just a couple hours of driving because Czech Republic, as you know, it's a neighbor country from Germany, so we are not so far from here. Even just for your information, from Brno, go to south, 1.5 of driving, we are in Vienna, so we are really close to the different countries. And as was mentioned in the previous talks, we have to be very careful about the legislation because it's different in every country. So we are in the Union, European Union, but if you see the rules in the Czech Republic, in Germany, and Dutch and other countries, it's not comparable. So you have to be very careful where you are and how do you handle treatment and how do you handle business there. What is important that 10 years ago, I will have there some conclusion about these days. Czech Republic allowed to treat with medical cannabis as a second country in the Europe. Yeah, it was kind of unique thing, and based on that, you will see the story what I'm presenting here. What happened in these almost 10 years in the Czech Republic? So just for your imagination, this is our hospital, more than 230 years. So which means comparing to the history of cannabis prescription, almost nothing. We have huge research center focused on many different diagnoses. And let's say the youngest one research group is the cannabis group, which I'm very proud of because I'm the head of this group. And it just shows that we are focused only on the business, but also on the research. And I think this is the most important. If you want to go and focus on business, you need some results and you need to support the scientific background. Just one point and one touch of history. Our hospital is located close to Mendel Square, and I'm pretty sure that all of you who had biology at elementary or grammar school, you heard about Gregor Mendel, the founder of genetics, and there was just coincidence that he worked with peas and he made his explorations on the Pisum sativum, but also at the time it was very closely that he could select Cannabis gigante at the time for his experiments. Yeah. So even Mendel had a touch of cannabis in his life. I talked a little bit about treatment, so please don't forget that cannabis is not panacea, it's not the thing for everything. It's an option. It's an option of treatment. So if you have 10 different medicaments, so this is the option number 11, and there's just concluded the meanings of our Nestor from Czech Republic, Professor Hanuš, who is already living more than 30 years in Israel. He spent his productive life in a Hebrew university, and these are his words. It doesn't always cure, it doesn't cure everyone, it doesn't cure every disease, and it doesn't cure every stage of the disease. So this is medical cannabis option. We say option. With this name of Lumir Hanuš is connected another very important date, and it was observation of the molecule tetrahydrocannabinol. You can see that in the year of, what is the pointer? This is the pointer, sorry. 1963, the molecule of THC was discovered with mechulam, but also in that time, Professor Shantavi, who was guy from Czech Republic, from Olomouc, he made exactly the same. But the point was the presentation and the publication in the time, because we were under the communistic regime, and the news were just covered in our union, let's say. Yeah. So, and it was not easy to join and to compare this information to the world. But afterwards happened that these guys met and they confirmed that they observed even the same molecule. So this is kind of interesting thing connected to Czech Republic. And I mentioned almost 10 years of history in the Czech Republic. So what happened? We got the law. We wanted to start to prescribe medical cannabis, but nobody was do a production of medical cannabis in Czech Republic, so we had to import something. So first batches were from different countries, from Holland, from South America, Canada, and so on. But after a couple years, the situation now is that we have more than 10 authorized or certified legal producers of medicinal cannabis. I'm highlighting medicinal because this is the only purpose what these guys are able to do. And myself or our university or hospital, we are having the research license, so it means that we can use cannabis, medical cannabis. I'm speaking about the cannabis with the ratio of THC or with the level of THC more than 1%. For any different purposes. I will talk about it later, but the point is connected with commerce, that from last year, almost 2 years ago, we are allowed to grow, to process, and also to distribute medical cannabis as a commercial partner. So the thing what I want to say is that we are not only treating, but we are also having production facility. I'm a little bit shy to say the number, which is our capacity, because to the numbers which I already heard here with different producers, it's quite funny. It's 25 kilos per year, please. Yes, so it's really teeny tiny batch. But this is the consumption for our patients, or production for our patients for our hospital. Yeah, so it means that we are almost, or we are sustainable, and we produce the amount which is needed, which is necessary for our hospital. Yeah. So this is the circle which is already which is already actual in our conditions. And just for your information, if we speak about the market of Czech Republic, we are speaking about 250 kilos, which is prescribed per year. Yeah, so please, we are 10 million people as a republic. We have officially about 3,000 patients, which is quite small number, and the consumption is about 250 kilograms per year. Yeah. So if you compare like the number of the inhibitors, for example, to Israeli and number of the patients, it's incomparable. Yeah. So these are totally different numbers, or the amounts of the consumptions are really different. But on the other hand, the model which is followed in the Czech Republic is very precise, because you are or you think that you are patient, you go to the doctor, you get your diagnosis, and the doctor decides if you are able to be treated with the medicinal cannabis. If yes, then he prescribes you the medicinal cannabis, and though you go to the pharmacy to get your medicine. And the point is, what I want to highlight is that 90% of the prescription or of the treatment is paid with health insurance. It means that for the patients it's quite cheap. Yeah, there are, which I already mentioned, these numbers and diagnoses, which are the specializations from the doctors, which are the most common. Chronic pain. Yeah, this is the major diagnosis. We will discuss now, or we will discuss later. Up to you. How is it possible? Can we talk now, because there's some question? Can I accept the question? I think we still have time, right? We will have round table. Okay, so we will have round table, so we can discuss later. Just one touch of our research. This is published, our clinical trial, which was pointed in the phase 1, and just to realize if you know, or what are the conditions for the phase 1 studies. Any suggestions? Have you ever touched with the doctors or with the patients who were selected into the phase 1 study? Aleš, help me. He knows. Anyway, what I want to say, this is the most precise, let's say, evaluation from the side of the doctor, and also from the patient, that this is not kind of marketing study or some questionnaire or something like that. Yeah. What I want to say, that we had a question for our patients when they can drive, when they can operate vehicles, when they are treated with medicinal cannabis with the proper dose of THC. You can see I'm not very familiar with this pointer, but this is the amount of THC which was used for the patients. And we are speaking about the chronic patients who are using medicinal cannabis more than for half year. Chronic patients, yeah, because there are questions that if we use medicinal cannabis, we have some depots of THC in your fat, and it can be occurred under some stress, and so on and so on. Anyway, you have patient, you have proper dose, which is taking via capsula. I will show you later what does it mean, capsula, in our way. And these patients were just closed into the department of clinical pharmacology unit, which means the major point is that they were not able to be influenced from some other side. Yeah, so openly speaking, they were not allowed to go outside to go for a joint. Yeah? So not to be influenced with some other source. This is the meaning of phase 1 study, clinical pharmacology unit, and to have your patients under observation. And from these patients, we were taking just the line or just the timeline of the blood samples and to see how is it going with the THC in their blood system. I try to be a little bit shorter because time is flying. The findings is very nice that our patients who are using these capsules with these proper doses, they can easily in the morning drive their cars and go for a supermarket for fresh bread. Yeah. So this is the message which we got from this phase 1 study and from this observation. And you know, through this day and yesterday, I understand that this meeting is focused on business and on money. But without these results, doesn't matter if it's paid from a company and from state or from some international grant, we are not able to support and to say the proper results of medicinal cannabis. Yeah. So this is, let's say, message from my side for all the companies here, support research. This is from Czech law, the table of indications for which can be prescribed medicinal cannabis. Openly speaking, it's everything. It's almost everything. Yeah? Point is that the doctors are not very familiar. Excuse me, they are lazy. They are lazy to try new things. Yeah, so they have just regular treatments. They have their biological treatments for any different diagnosis. So why they will try some medicinal cannabis, which is kind of a cheap treatment. Yeah. So this is the equivalency there. Why we don't prescribe more medicinal cannabis for more diagnosis, but the answer is what I already mentioned, and for that we need more education, we need more seminars for doctors and pharmacists, and good and also bad examples that the cannabis is here and this option can work for our patients. Form of use. This is something what I want to show you. Of course, smoking, no, please. Yes, we are speaking about treatment, we are speaking about hospital and the patients, so smoking is not the way how to use and how to applicate cannabis. Vaporization is another option, but what was developed in our hospital from the hands of Dr. Hřib a couple years ago is a capsula. Easy way, just to take your capsula, eat it in a couple minutes, you got the effect. It works. Why we think that it works, that the patients are still coming for the capsulas, and 10 or 9 from 10 patients wanna prescribe capsulas, not the dry floss. It looks like this. Vaporization was the phase of using dry floss before. We already had place for vaporization directly in the hospital because you know that the machine is quite expensive, so not every patient, because we are, just for your information, most of our patients from Center of Chronic Pain are seniors, are people 60 plus, 70 plus, and they don't care about some high effect. Yeah? They just need the medicine and they want to sleep better. They want to have the feeling that the pain of their hips or of some joints is a little bit more easier for them. So this is just what is the major group of our patients. So if these immobile people should go into the hospital and to vaporize there, it was complicated for them. Yeah, so and too expensive to buy this vaporizer home. Yeah? So this was an option. We tried this, but also there's another complication which was mentioned here. There was nice talk in the afternoon. The differentiations, how you vaporize. Yeah, that the size of the molecule is one thing. How long you hold it in your breath is another thing. Yeah? So the effect of the active compound which goes inside into your body, it's non-comparable. It's by each patient is different. Yeah? So based on that, they developed this tiny, easy thing, capsula, and they just put the cannabis floss into the capsulas as an individually processed medicament. This is the material which is prescribed in the pharmacy from the doctor. This is from our pharmacy. They just very easily they weight the proper amount. This is very important. They do the decarboxylation in some oven or in some sterilizer, but the ratio, I mean the time and the temperature, this combination is very important because you decarboxylize your compounds, you do it active. Yeah, so this is the teeny tiny trick. And after that, they grind it, they homogenize it, and they fill it with some lactose or starch. And they prepare 30 capsulas for the patients. So it's an individual preparation. So if you remember to talk from the morning about this Greenhorn Pharma, how they do this thousands preparations per patients in minute, like da, if you remember the guy. So I'm a little bit shy to show you this kind of Middle Ages technology, but it works. But it works and it's cheap. So excuse me, this is the situation in our hospital. How it is going, and I have to say we are kind of proud of that. This is the story which is already over, but before the capsulas I mentioned that we had this vaporization unit with this old-fashioned vaporizer with this big plastic bag, but it wasn't very, let's say, successful, and I already explained to you the complications and the obstacles with that. So this is kind of, let's say, unique thing that 90% of the treatment is paid from health insurance, which could help to prescribe more and to spread it more into the medical community to use medical cannabis. And this is my favorite and my passion, tissue cultures. I already spoke to a couple people here about tissue cultures because this technique is not nothing new. Yeah? So our let's say teachers and professors, they already use tissue cultures for multiplication and conservation for many different agriculture crops. But these days we are using tissue cultures for medicinal cannabis. Yeah? So wow, something sexy, something new. But point is, it can be very sufficient, very effective, especially for producers with larger capacities. Because when you multiply, just I should start with the question, have you ever heard about tissue cultures? Should I get you some basic information? What is it? You know, it's a plant production in lab conditions, in a sterile conditions. Yes, so we don't have field, we don't have greenhouse, but we have a sterile lab. This is the trick. And if you see the material there in these tubes or in these tubes, this is cannabis, and the advantage is this is this is plant material without any without any pest, without any virus, without any other infection. And you can keep in these conditions, I can say, forever. When I say forever, it means that you have to feed these plants, of course. So it means that you have to transfer it into a new substrate, let's say in 3 months or half year, depends on the technique which you use. But this is the way of conservation. So when you are a producer and you don't think about some backup, so start to do it, because once can happen, then you will get any virus, you will get any blackout with the energy, and your facility will be ruined. And as you heard, most of the producers are very proud of the genetic material which they have. So you should have to back up this material. And this is the method which I'm not only presenting and promoting, and also providing, can say, as a service for the clients to do a backup. One thing is to transfer the material into the sterile conditions, to secure them and to prevent them from the infections. And the second is to keep it in, let's say, in our labs or in your labs as a backup. So this is easily, very easily explanation. What does it mean, tissue cultures? Here you can see when they are multiplied in the glass, and from this glass, this material is easily transferred to the small pots and start to grow as a normal material for your commercial production. This is in the, let's say, larger scales, and as I told you that this is nothing new, this technique. Anybody of you has a garden, and in the garden, let's say, plum tree or apricot tree? I think yes. So if you buy today these trees, all of them are produced with these techniques, and then they are grafted, the special varieties on these plants, which are on the beginning produced with these techniques, because to be safe, to be sure that they are without any pests. So this is tissue culture. This is me. This is me in our small facility, that I'm not just speaking, but also sometimes I go there and to do this lovely work, and then to feel the smell of our product. And we are also speaking scientifically, and I would like to invite you for already 10th anniversary of our conference into Brno, which will be held on 2, 3, 4, 5. That's important to remember. 23rd of April of 25 year. So it means beginning or spring of the next year. And the place is Planetarium and Observatory in Brno. So if you wanna know more, how is it not only in Brno and in Czech Republic with the cannabis, and what I have to highlight, if you see the list of the speakers, of the scientists, mainly professors all around the world, I'm really proud of that they came to Brno this year. So I'm looking forward for the next year, and I hope that you will accept the invitation and you will come to Brno also. Thank you for your attention.